The following presentation will begin with a staffing definition accompanied with some key concepts. Then we'll move on to case study A, and then we'll identify issues presented within the case study. After that, we'll move on to analysis and recommendations and end things off with a summary. Staffing, a process of determining the appropriate number and skill mix of personnel required to meet acceptable client treatment and care. Managers are responsible for allocating and organizing resources, including equipment, supplies, services, and human resources, which makes up the largest portion of the total operating budget. They set standards and directions for practice, making them responsible for all aspects of service delivery. Ineffective staffing, however, increases errors, accidents, absenteeism, poor morale, labor strife, and employee turnover. Negative patient outcomes associated with ineffective staffing include increased falls, UTIs, pneumonia, infection, and pressure ulcers. Therefore, it is important for managers to know the philosophical framework in which they work, population characteristics, environmental factors, and personnel characteristics when drafting their staffing schedules. Due to the significant impact that staffing can have on patient care, managers are legally and ethically required to plan schedules and staffing to meet safe patient care according to professional standards and policies. It is their ethical imperative to optimize positive patient outcomes while still balancing staff satisfaction. They must continually improve, examine, analyze, and shape the work environment. To do this, the manager must seek input and feedback during the staffing process. This promotes autonomy, trust, collegiality, and professional contribution. Additionally, managers must understand the tolerance for shift work and its impact on individuals. They need to consider the physiological, emotional, and social consequences of working shifts. Because staffing is both important and complex, conflicts may be inevitable. To address this, there are 6 steps for conflict resolution. It begins with identifying the problem, discussing possible solutions, analyzing those solutions, selecting a solution, then implementing the solution, and finally you will evaluate the solution's ability to resolve the original problem. Keep these concepts in mind as we go through the following case study. The following case study will be presented through a skit. There will be select points of discussion and issue identification. Now, without further ado, let's begin. You are the manager responsible for an emergency room in an urban hospital in British Columbia. Historically, the ER is busiest on weekend evening shifts when physicians' offices are closed and motor vehicle accidents are more prevalent. When all scheduled staff is present, the staffing level is sufficient for the workload. Patty has been an RN in the ER since it opened 2 years ago. She's generally well liked by all the employees and provides a sense of humor and lightheartedness in what is usually a highly stressful environment. Patty and the other registered nurses on the unit are members of the BCNU. Patty has a reputation for being a party animal and is known to begin partying after work on Friday night, closing down the bars by Saturday morning. During the last 3 months, Patty has called in sick 5 of the 7 Saturday evenings she was scheduled to work. Each time, efforts were made to replace her, but there were no qualified staff available to come in. Let's see what Patty's up to this week.
Ma'am, it's 5 a.m. The club's closed. You gotta go home now.
I think I gotta work.
As a result, the remaining employees have had to work understaffed during the busiest night of the week, and they are becoming very angry. They have asked the manager to talk to Patty and deal with this problem, or to staff an additional employee on the Saturday evenings that Patty is assigned to work.
Becca, have you seen Patty anywhere?
No, I haven't. Is she not here?
I don't know. I couldn't find her, and I have to give her a report.
She called sick again.
If she did, it's gonna be like the 6th time already.
Did you see her Snapchat last night?
No, I didn't.
It was like someone else's butt with like strobe lights everywhere. I think she went out really late.
Big surprise.
It's like the 5th time it's happened in the last month. Where's Liat? We should tell her.
Hi guys, how are you doing this morning?
Not too well. We can't find Patty anywhere. Who's gonna relieve me?
Patty actually just phoned in sick a few minutes ago, so she's not going to be here this evening.
Are you serious?
Yeah, sorry guys, I just came to inform you. There's going to be some changes with the floor plan, but...
So no one's covering for her?
Am I gonna be paid overtime for this, or do I have to stay longer, or what?
No, you're going to go because you're already in overtime. We tried to call someone in, so we're going to wait on a response to see if Jenny can come in. But right now I'm going to be on the floor with you, and then we're going to get a casual up to try and help us out.
So am I going to be responsible for like 8 patients
For
until someone
now,
comes?
yeah, and I will be there to help you.
That's ridiculous. That's not safe.
This is ridiculous. Patty keeps doing this to us. Like, we're so stressed. It's the busiest night of the week. Like, does she know like what's going on right now? Or?
We are dealing with it. We know this isn't the first time it's happened, and I can understand how frustrated you are and how hard it is to try and deal with this last minute. So just know that we're dealing with it.
Okay.
All right.
The issues identified include Patty continuing to call in sick on short notice after partying the night before. Furthermore, nurses are becoming very upset due to working understaffed and overwhelmed during the busiest nights of the week. Implications for understaffing include decreased job satisfaction and increased stress. Workload also exceeds appropriate capacity for a lower number of nurses. With more work and less time, nurses may not be focusing properly, leading to a rise in errors and associated costs. Ultimately leading to a negative and stressful atmosphere, patient morale and confidence in the system will also decrease. Some important points to consider is that staffing on the unit is generally adequate as long as all scheduled individuals report for work. However, Patty has missed 5 out of the 7 scheduled Saturday night shifts within the last 3 months. Patty has seniority on the unit due to working there when it first opened 2 years ago. However, every time Patty has unexpectedly called in sick, no qualified personnel was available to take the shift on such short notice. The type of conflict identified in the case study is an organizational conflict. There is a disruption in the working relationships and a creation of a stressful atmosphere. This conflict exists to the level that productivity and quality of care are compromised. Therefore, the manager must attempt to identify the origin of the conflict and attempt to resolve it immediately. Keeping in mind some of the concepts that we've already gone through, here are some questions to consider. What should the manager do to solve this issue peacefully, and how will Patty be involved? What can the manager and Patty do to ensure that the staff do not unexpectedly work understaffed in the future? And how can Patty break this addiction to partying and instead put her career first?
Upon hearing the complaints from the other nurses, Liat, the manager of the ER, called a meeting with Rebecca from Human Resources. Tony from BCNU was also in attendance.
So thanks everyone for meeting today. We're here to talk about your attendance lately, which has been an issue in the past. And we just kind of want to get to the bottom of the situation, figure out what we can do to help it, and make sure that attendance to shifts is more regular. So maybe can you start off by telling us a little bit about how you feel about meeting today and the situation?
I'm happy that you guys did call a meeting because it lets me know that I am working in a supportive environment, but I do live my life. I am a young nurse and I am very good at my job and I am passionate about what I do, but I also know that I need to have my self-care, so I do like to go out on the weekends. And I mean, if it means I miss a couple shifts, I think as long as it's getting covered, the patients are okay. I think that, missing a shift every now and then is okay, right?
Right, well it hasn't been every now and then. It's been pretty consistent in the past little bit. And I agree that self-care is so important, you're definitely right about that, but we can't have it affecting the unit so consistently because it's putting your colleagues under a lot of stress because then they have to pick up the pieces, right? Last minute when we can't find people to cover.
Yeah, I guess I didn't really think about that.
Yeah.
Following the steps of conflict resolution outlined earlier, The manager held a meeting with the appropriate team members. They clearly identified and outlined objective data about the situation, which was Patty's absenteeism from work. They allowed Patty to speak from her point of view, and they maintained respectful communication.
I understand that it's important to have a safe environment for all other nurses, but Patty is entitled to have a sick leaves. So did you guys consider about hiring more staffs or scheduling extra personnel on Patty's shift?
The issue with that is that we do have enough staff and we are well staffed for those shifts. We've noticed a pattern that it's been mostly on Saturday night shifts, which is a busy night, and often it's hard to get those shifts covered because people have plans already. They go away for the weekend and they can't cover it at the last second. So I don't think that just hiring more people or scheduling extra people is feasible based on our budget.
That's true.
Yeah, I mean, the reason that we wanted to have this meeting with everyone involved is because you are such a valuable member of our team. We really feel like we need you, and you're one of the more experienced nurses on the unit. And we love having you here, and we get such positive feedback from your coworkers. So we just want to figure out what we can do to support you and just make sure that everything's functioning the way it should be.
Yeah, for sure. I mean, I guess maybe I can stop calling in sick. Maybe stop partying so much. Because I really want to keep my job. Like, I hope that I can keep my job here, and that is my ultimate goal. And safe patient care is important, and I don't want to let my team that I work with down. So, I see your guys' points.
So Liat, how about altering the scheduling for Patty? Do you think that is a good option?
Well, Patty, is there anything that you think would help you as far as the schedule? Are there certain days that you feel like you really can't work, or is there anything that we can do to support you as far as the scheduling goes?
Well, I do like to go out on Friday nights, and that's why I don't usually come in Saturday nights, because I feel awful all day Saturday and then Saturday night as well. So maybe, as much as I hate to say it, maybe schedule me Saturday morning so I don't feel as inclined to go out on Friday nights. And, or maybe, schedule me Friday nights and give me Saturday nights off. So that I work Friday night and then I can take care of myself Saturday night and then be good on Sunday.
Numerous solutions were suggested, and viability of plans were discussed and analyzed. For example, Tony suggested hiring extra nurses. However, Liat and Rebecca pointed out that the original problem is Patty's continued absence, and if she did show up for work, they would have no issues to begin with. When asking Patty for her input, they're following the golden rule of employee involvement. This means including a staff member in decisions which enhances their responsibility and accountability, while preserving their autonomy. Ultimately, Patty suggested changing her schedule so that she would work on a different day.
I think that's a good option. The other thing I wanted to talk to you about was the health resources we have for staff. So you know that we offer, through your work, you get discounts for things like yoga and the gym, counseling, things to take care of yourself, your own health. Is there anything of that you think would help?
How often are the counseling sessions? Is it weekly? Or?
You get up to 10 a year, covered 80%.
I might be interested in those.
We can definitely arrange those for you, because as important as it is to unwind and relax on your own time, you do want to make sure that you're being healthy about it, and maybe being so sick that you can't come into work every weekend is an issue to evaluate as well.
Yeah.
So I think that counseling might be a great start, if you're open to that.
I am.
So Patty, how would you feel about signing a contract where you establish some goals and parameters for yourself that we'll evaluate together, and then we come back and assess it in a month?
I think that's a fair thing to suggest and do.
Perfect.
So can you think of anything anything that should be on there?
Well, maybe to make your goal to stop calling in sick after a night of partying.
So you won't call in sick for the next month without a doctor's note?
Yeah,
And
and if I do call in sick, yeah, provide a doctor's note.
Yeah, so we'll put that you need to have a doctor's note when you're calling in sick.
Yeah.
Is there anything else?
That I attend all scheduled shifts unless I do have a doctor's note.
Okay. And then will you want to include anything about self-care?
Yeah, maybe go to at least one counseling session before we meet again.
Those sound like really good goals. That's a good start, I think. We can make sure that we support you in those as well and that we're available if you need anything.
Excellent.
Great.
Thank
So,
you for meeting.
yeah, so you have my email address if you need any support in any way or any more information about the policies that we have here regarding sick days and the resources we have available to you.
Okay, thank you very much.
And you have Tony's email address if you need support from the BC Nurses Union if you feel you need that.
Thank you.
Let's refer back to some of the questions we asked. Patty was involved in solving this issue by attending a supportive meeting which was held to voice concerns related to objective data. Open discussion took place and allowed Patty to provide contributions towards her own plan. Patty has opted to schedule her shifts earlier in the week so that A, she is not inclined to party prior to the shift, and B, her old shift will be properly covered after switching with other staff ahead of time. And finally, Patty has agreed to begin exploring more self-care options other than partying, starting with counseling support suggested by the Human Resources Department. This is to ensure that Patty's physiological, emotional, and social health are taken care of so that she may be effective while working shifts. Continuing with the steps of conflict resolution, Patty will need to implement those plans that were agreed upon during the meeting. Afterwards, the outcomes of those plans need to be evaluated for their effectiveness. If Patty continues to be absent for her shifts despite trying the plans that were suggested, then the issue will need to be reassessed and discussed, starting the conflict resolution process from the beginning. To summarize this presentation, understaffing can cause excessive stress, creating negative and dangerous environments for employees and patients due to the potential for increased errors. Therefore, managers are legally and ethically responsible for safe staff scheduling, as well as dealing with conflicts affecting safe patient care. Managers must address these issues immediately, and the employees must be directly involved in planning in order to support and increase accountability and responsibility while maintaining autonomy. Lastly, we'd like to thank you for joining us throughout this presentation. Always remember, joining a party today might mean leaving the team tomorrow. Party responsibly.